How to respond to a pleural lung cancer diagnosis. Pleural lung cancer is a diagnosis that is made after your doctor takes a biopsy, a small part of your tissue that is analyzes in a lab, from your lungs. If you have been told that you have lung cancer, discuss the diagnosis and treatment options with your doctor, while also making lifestyle changes and seeking the support of your loved ones. Method 1. Learning what you can about the diagnosis. 1. Take some time to research your condition. Learning about pleural lung cancer may help you to feel a bit more prepared to face the cancer head-on. The pleura is a space in between your lungs and chest wall. It contains pleural fluid that is responsible for lubricating your lungs and chest wall while you breathe. When a cancerous tumor develops in the pleura, it is considered pleural lung cancer. Ways to learn about pleural lung cancer include discussing the condition with your doctor, running an online search through different cancer websites, talking to friends or family members who have experienced or are experiencing this condition, or who have a loved one that is, reading books or articles about pleural lung cancer. 2. Don't hesitate to ask your doctor about the diagnosis. While spending time at the doctor's office may be the last thing you want to do, it is important to learn what you can about your condition. Your doctor will be more than happy to answer any questions you have about this type of cancer, as well as your specific diagnosis. 3. Be aware that this sort of cancer is often caused by exposure to toxins. One possible cause of pleural tumors is exposure to asbestos and smoking. Asbestos is a potentially hazardous mineral. Cigarette smoke can also lead to the growth of a tumor in the pleura. 4. Be prepared for the symptoms that occur because of pleural tumors. You may find that you begin to experience these symptoms as your pleural tumor continues to grow. These symptoms can include shortness of breath when you do physical activities. Shortness of breath can occur because fluid may begin to accumulate in your lungs as the tumor grows. Prolonged or chronic cough. A persistent cough can indicate an infection in your lungs or that the tumor is growing. Infections and tumors can lead to the growth of scar tissue in your lungs that can irritate your lungs, causing you to cough. Weight loss for no apparent reason. Lung cancer can cause you to lose weight, though the reason for this is unknown. Weight loss generally occurs in people with solid tumors. Pain in your chest. Chest pain can occur because the tumor can cause tissues and muscles to tear, causing scarring and pain in your lungs. 5. Be ready for possible physical changes. Having any kind of cancer can change your physical being. While everyone reacts to conditions in different ways, common changes that occur in people diagnosed with lung cancer include weight loss, stress-induced physical changes like fatigue, pale skin, and loss of appetite. Method 2. Discussing treatment options. 1. Discuss the available options of treatment with your doctor based on your specific condition. Lung cancer can be treated in a variety of ways. However, the treatment that your doctor chooses for you will depend on your overall health, the size of the cancer tumor, the exact location of the tumor, the stage of the tumor. 2. Talk to your doctor about surgery. This is done by a thoracic surgeon. The goal of the surgery is to remove the whole tumor and the surrounding lymph nodes. This is done to ensure that no cancer cells are left on adjacent tissues. The time taken for recovery will depend on the surgical procedure that has been done and the amount of tissue that has been removed. The recovery will also depend on your condition before the surgical procedure. 3. Consider radiation therapy. Radiation therapy is a treatment option where X-rays that have high energy are used to destroy the cancerous cells. This procedure is done by a radiation oncologist. The most common type of this treatment is external beam therapy, where a machine is placed on the external part of your body. Radiation can also be given using implants that are inserted inside your body, which is called internal therapy. The side effects that may occur after radiation therapy include decreased appetite, fatigue, sore throat and dysphagia, difficulty in swallowing. Your skin might also feel irritated where the therapy was applied. 4. Consider chemotherapy. Chemotherapy involves taking drugs that may stop the cancerous cells from multiplying and dividing. Most of these drugs are given intravenously and work systematically through your body in an attempt to kill all the cancerous cells. You may receive several drugs at once. Side effects may include nausea, vomiting, fatigue, decreased appetite, hair loss, diarrhea, and increased risk of infection. You may be given other drugs that will help to reduce the side effects that may occur during chemotherapy treatment. 5. Know that some of these treatments can be combined. Some of these modes of treatment may be combined to increase your chances of defeating the cancer. For example, you may have a surgical procedure done to remove the cancer, followed by radiotherapy to kill off any remaining cancerous cells. Method 3. Making lifestyle changes. 1. Maintain a healthy lifestyle. Don't let a pleural lung cancer diagnosis hinder you from doing your usual daily activities. Maintaining a healthy lifestyle can help to keep your immune system strong and boost your overall health. The following steps will outline how you can live in a healthy lifestyle. 2. Stop smoking. If you have been diagnosed with lung cancer, it is important that you stop smoking. You should also avoid being around cigarette smoke, even if you are not the one smoking, as cigarette smoke can make your tumor and your overall health worse. It can also exacerbate your shortness of breath. Ways to quit smoking include going to support groups, using a nicotine patch, talking to your doctor about other medications you can take to help break the habit. 3. Exercise regularly. Try to exercise often, but always stop if you are having difficulty breathing. Exercising can help to strengthen your lungs. Try simple exercises like walking every morning. You could try walking 10 to 20 minutes every morning to try to strengthen your lungs. 4. Eat healthy foods. Creating a healthy diet for yourself may help to combat other medical conditions that could develop because of your lung cancer. In particular, foods rich in fiber can help to keep your blood pressure normal and manage other body functions. Fiber-rich foods include green leafy vegetables like spinach, cabbage, turnip greens, and lettuce. Fruits like apricots, apples, bananas, blueberries, plums, pineapples, and melons. 5. Get regular check UPS. This will help you know if your status is improving or not. It is important to keep track of your health. Your doctor may have specific advice for your condition that will help to keep you as healthy as possible. Method 4. Seeking support. 1. Talk to family and friends about your condition. While it may be very hard to do, it is important that you tell your family members and close friends about your diagnosis. Having a support network of people that you love can provide you with the moral support and strength you will need to fight your illness. Sharing your thoughts, fears, and feelings is an important part of accepting your condition and facing it head-on. 2. Join a support group. There are many support groups for cancer patients. These groups can help you to deal with your diagnosis and help you find ways to handle the situation. You may also find that it is helpful to talk with other people who are going through the same things as you. You can find support groups online. Your doctor may also be able to recommend support groups in your area that you can consider going to. 3. Do not lose hope. Keeping a positive attitude is an important part of dealing with your diagnosis. While it is completely natural to feel sad, angry, or lost when faced with this news, keeping your hope alive and spending time with loved ones is an important part of gaining the strength to fight your illness. Tips. Do not be afraid to ask your doctor any questions that you may have.